Hello and welcome. I was thinking about how I wanted to start the session today, and I kept hearing and seeing the word wow in my mind. You are an incredible group of people. So when I think about this topic, creating a culture where ideas grow, we're certainly in the right place to have that conversation. So I changed the title a little bit. I decided to talk about creating a culture where ideas grow into innovations, because for me, innovations imply actions. And so when I think about that, I think about the focus of my work and how I came into healthcare and based on all the different work that I've been doing. So about 4 years ago, I was doing a project for the Ministry of Health related to perfusion. And then I ended up going to St. Paul's Hospital, and I walked into St. Paul's Hospital, into the Burrard Street entrance, looked down the hallway to Comox Street, and all of a sudden I was flooded with memories. In 1988, I was a young person out of university, first job, working at St. Paul's Hospital, right in the middle of the AIDS crisis, and we were trying to rally organizations together to present the first World AIDS Day event. And I was standing in that hallway with Sister Mary Celestine, and I was feeling anxious about AIDS and all the stuff that we didn't know at the time. And she looked at me and she said, I was asking about how come St. Paul's was at the forefront of this. And she looked at me and she said, if not us, who? So as I walked back in there 25 years later, all of those memories came back to me, and I remembered how much I loved working in healthcare. I was doing a lot of work in the public service, a little bit in healthcare with the ministry, and I made a decision at that moment. I was in the middle of a PhD. I changed my dissertation to work in healthcare, and I haven't looked back. So I teach in collaboration. I'm an adjunct professor at UVic, and all of that is thinking about how do we build solutions in healthcare with all the multi-stakeholders that have to be involved in these different types of conversations. So when I think about innovation, innovation is about action. We heard about disruptive change last year at the conference. We heard from Jim this year about radical cost innovation. And all of those seem to me to be a call for aggressive action. And I think that's what this group is all here for. So when I think about these different pieces, today we're going to talk a little bit about how to create a culture of innovation. We're also going to talk about the barriers to innovation, and then we're going to go a little bit underlying how come if we know how to build these cultures and we know what gets in the way, what is lurking beneath us that is the real impediment, and what can we actually leave here today as individuals to do about that. So the main pieces around a culture of innovation, if we do a summary of the literature, are basically focused around these 4 areas: people, place, positivity, and process. So if we take what I would say is definitely a culture of innovation, which is this quality forum, I would say let's take a little analysis. So we look at the people, best practices in team development with an emphasis on a diverse range of people. Well, as I've sat at different lunch tables and had bathroom conversations and hallway conversations and visited with people in the different kinds of workshops, we certainly have a diverse range of folks here. We also have a learning environment that is unparalleled. I said to Chelsea the other day, you have so many pens. It's so great. Every time I need a pen, there's just one there available for me. This is a community where you can have self-organizing groups creating all the wonderful things that you're doing. You have solution-focused conversations. There's a sense of positivity, generativity in the room. And you also have systems and structures which are supporting rather than restricting innovation. This doesn't feel very bureaucratic or regulatory as we all spend our time here together. I also noticed that something that's interesting, typically when I'm in organizations or facilitating innovation, we have a very narrow view of what that is. There's lots of different kinds of innovation, and I think as we think about cultures, how do we acknowledge that in fact we are cultures of innovation and cultures where there are ideas? These will actually be put up on a website, so for those of you who are taking pictures or notes, and I can also send you backup information on this if you want. So suffice to say, I even think I've been doing some work at the ministry on the primary care home concept in the strategic agenda. And some of these new concepts that are coming out are full paradigm shifts in how we even conceptualize healthcare. So there's lots of different ways for us to think about these things. So how do we go about building an innovation culture? When you look at the literature, kind of in my field of social sciences, you look at a systematic review, they all say about the same thing. Well, we're not really able to compare because everybody uses varying degrees of methodologies. But they do give us some clues about some of the things you can see when you look at a culture that you would say is innovative. So, one of those is creating safe spaces. So here are just some ideas of things I've seen and or worked on in the healthcare system. Many of you will have participated in an IHI style collaborative. If you haven't and you have the chance to, they're really amazing. It's a format by which you bring a whole bunch of people together, typically all across the province, and they do a wide variety of projects all around a central aim and a few drivers, and measure it with PDSA cycles. I'm working on one with stroke rehab right now, and the work these folks are doing is absolutely amazing. One thing I want to mention is I put down innovation labs only to learn that this organization, of course, has an innovation lab. And on my very first ride up the elevator, I was heartened to see that that Vancouver Coastal actually has a job called Director of Innovation and Evaluation. So we see there's all sorts of pockets, and I'm sure there's many more of you sitting in the audience that I didn't have a chance to meet. You want to develop innovation champions. I would suggest that we want to seek out those people who are innovating and say, what do you need? How do I get things out of your way so that you can keep moving forward? What would our organizations be like if we actually had, instead of CEOs, COOs, CTOs, how about if we had a chief innovation officer, a chief creative officer? Catching people innovating, bragging and stealing, that's actually a thing I learned about that they do in the world of stroke when they go to the Stroke Congress, and maybe in other professions you do that work where you show your ideas and you take new ideas. How do we do that in our agencies and in our hospitals and in our care homes so that we can have that as a lived daily experience in our cultures of innovation? We also want to ensure there is clarity and consistency. From my work and engagement, and I used to do a lot of work with teams in crisis, I would say one of the most disengaging components for teams and for people is inconsistency between actions and behaviors. So how do we get that clear and compelling purpose and then do our best, no matter what level you're at? If you're the CEO, the manager, it's your first day on the job, how do we walk the talk, so to speak? We want to allow opportunities for self-organization, diverse viewpoints. This is that whole systems thinking stuff. So for those of you who have whatever your perspective or the model you use to think about organizational systems, complex adaptive systems, how do we invite dissension and new ways of thinking? Do you actively seek out in your organizations the radicals, the people who are a thorn in your side, and find out what they're thinking, find out how they're being disruptive, and use that in a way to start and innovate new, to innovate new ideas. How do you build interconnections between people? Is it easy for people to connect? I was working on a project that was with staff and from the different health authorities, and it took us 3.5 months to get a SharePoint site so that people could connect with ideas. No patients, no research, just staff, but it took us almost 4 months to make those interconnections happen. And the last thing is can you support it with innovation, support innovation with training and tools? I went to a workshop this morning, Colleen and Andrew from the Innovation Lab. They were teaching design thinking. I teach design thinking. I've gone to lots of design thinking things, and by far it was the best presentation and the best resources I have seen in a long time. I would say that, yeah, it was really great. And I would say that they are online with IDEO, they're online with Stanford University, they're online with all those other folks who are doing that work, and they're right here in BC. They're probably sitting somewhere in this room, but I really can't see you because there's a lot of bright lights. So it was there, they're over there. And they're just giving these to you. So you've got all these resources, and I think that there are pockets, I keep finding them in the system, of real brilliance, and people are so very willing to share all of their knowledge. We also have TED. The fact that it's in Vancouver is sort of irrelevant because you can get it online. A lot of times when I'm working with clients and they want to do stuff with their teams, you don't have to hire someone to turn on a TED video and then get your staff to engage with it. People are so resourceful and interesting. Find a topic, what is working, what isn't working in your group, stick up the latest and best TED Talk and have a conversation about it. But there are some barriers. So right now we're really talking about what do we do at the organizational level around culture? What do we do at the organizational level around some of these barriers? So again, looking at the literature, here are sort of 5 of the main themes that you might see when you went through that. So I've set these up mainly because I knew that you'd be able to see this PowerPoint afterwards. I'm not going to stop on all of them because there's some other pieces that I want to get to, but I've set them up that there's some questions we can ask ourselves around our assumptions and our understanding of these ideas. Incorrect measures. We heard yesterday, for those of you that watched that amazing debate on accountability, that measurement is a little bit of a thorny question. How do we measure success? How do we ensure that innovation's the priority, not the measurement? But I think that the question I should have added there is how much are we measuring, and are we really measuring anything that's being helpful to us? So it's really thinking about those different kinds of measurements. Is there a different way to think about what we're asking people to be accountable for? When I listened to that talk yesterday, I thought it really wasn't about whether or not we're accountable. I think we either are or we aren't, but how do we show and demonstrate our accountability? And the constant demonstration that's asked of being accountable is getting in the way of actually being accountable. Another one is money. We always want to say we don't have enough money. I'm not sure it's really true we don't have enough money. Several years ago, something I wasn't involved in, but it's a fabulous story, is they went out to build. There were some numbers that came out that showed that BC was not leading the way. In fact, was the lowest province in terms of numbers of people getting into stroke unit beds. So they went ahead, they did an IHI-style collaborative, this is Stroke Services BC, all across the province, no additional funding, 70 new stroke beds. That means that British Columbians are having much better stroke care treatment, and that puts us right at the top of the country instead of the bottom of the provinces. Money, though, can be found in miraculous places. I was in a session a few days ago. There was a group, and there was some hesitancy about should we be collaborative and should we invite other people into this conversation. So we did. We had a small group come in just to get people comfortable with that. By the end of the day, a program, they had found about 6 additional sources of funding, which will likely ensure their longevity, because they made an informal network, because they asked and because they involved other people. Extra time. I'm not going to say much on extra time. It always seems, though, when it's important, we find the time. I heard a project over at the ministry, one of their staff, because I don't want to take credit for this, I think it's so fantastic. She talked about voluntarism that is irresistible. How do we make the work we're doing irresistible enough that time doesn't become a consideration? And when it is, how do leaders sit down and really triage that which is actually truly making a difference to patients and engaging of our staff in our organizations? Avoidance of error, I'm going to talk about a little bit later. Siloing, I would say for me, in healthcare, unlike a lot of other organizations I've worked in, the not-for-profit and the public service, is healthcare has this amazing phenomenon of being able to manage sub-silos within sub-silos within sub-silos within silos. So because I travel around and I'm in different places, I find I get to see all these great connections and, oh, this would be cool if this person talked to this person. And so I've just started linking those people up, and they're finding out that there's all this great work happening, and I have this envisioning of this collaborative network, my SharePoint experience aside, that we could somehow manage to connect all of you great folks. There was a meeting about 7 months ago that BC-CDC was holding around collaboration, and this wasn't what it was about. It wasn't about how do we create a collaborative network, but the big idea that came out was someone there said, all these ideas around apps, technical people, please listen, and how there's ways that you can do all these different kinds of connections. Couldn't we do that same thing around ideas? I'm not sure who's doing that idea, but I left that session thinking, that was really fabulous. So we've talked about organizations and organizational culture. This is all the stuff that we know. It's the stuff you see on the bestseller books, the 10 ways to change. 1 week until your employees are entirely engaged. 5 ways to do team building. And yet, even with all those wonderfully written books and those fabulous models and all of our knowledge on this, we seem to still struggle in organizations. This model is an iceberg. And the idea is, it came from a scholar named Edgar Schein, who did a lot of early work on organizational design and systems. My little aside is, for those of you who are interested in leadership, I think one of the best leadership books is his book called Humble Inquiry. Anyhow, so he talked about all the things in the system that we can't see. It's all the systems that we can say are not available to our consciousness, or not to get Freudian, but are unconscious in how we operate in organizations. And those are the things that are really getting in the way, and the things that we actually have to spend time thinking about. In all the work that I've done, I know with a fair amount of confidence, I'm not Oprah, so I don't know anything for sure, but with some degree of confidence that all of the very best things that we add, and the models and the facilitators and the stuff and the dots and the everything, is not going to get us where we need to go if we don't solve that piece underneath. So it's the last talk. This is the end of the day. It's great. Yay, innovation, great ideas. But part of my job is to also be truthful about this piece, which we tend not to spend as much time on it as we possibly should. So how do I, when I'm working with groups, that's the stuff I'm thinking about. So I may facilitate solutions, but my academic research is on what gets in the way of solutions, and this unconscious stuff lurking below the surface. So we're going to do a little activity, because I can't not be somewhat of a facilitator, but it's a passive activity because you've all worked so hard. So we're going to start with this model. So if we're thinking about this idea about what lurks under the surface, so if you look at this image, A and B are the same shade of gray. I've used this image and people say to me, that's not possible that they're the same shade of gray. And I say, it is, you just have to believe me, but you all don't know me. So I went to the MIT website, who has a little bit more credibility with perceptual distortions. And so they give you your proof. I've given you the website. It is beyond my neurological perception ability. But suffice to say, they're the exact same color, and it's very complex why we can't see that. I don't know if any of you remember the gold and white, or the blue and black dress. Anybody remember that? Wasn't that bizarre? So for those of you who don't know what this is, and like, why are we talking about fashion right now, is that there was an image that came out, and some people saw this dress as yellow or gold and white, and some people saw it as blue and black. I saw it as gold and white, and I read about the phenomenon, and I thought, well, if it's just in my mind, I'm going to look at it and I'm going to think black and blue. And right in front of me, much to my creepiness, it changed into a black and a blue dress. So I shrieked. It was all very traumatic. Suffice to say, though, there's a lot of stuff going on in our brains for which we aren't even aware how much we're distorting things. These are the same shades of gray. I'll move through these quickly. These 2 red lines are the same length. If it was on a smaller piece of paper, you could measure it, but it's too high up. And the last piece, I am not that good of a PowerPoint designer to make those move, and they actually aren't moving. So I wonder, as we're sitting here talking about innovation and ideas, if we don't even get the visual phenomenon right, and I have a whole bunch of stuff on all our other senses, but we won't go there today. what does that really say for when we sit in a space and we start to collaborate? So often when I start sessions with groups, we'll do this activity because I'm asking people to suspend disbelief for the time that we're together, because for me, that's the only way we're going to be able to get innovative. Another thing that I like to do is I show this image, and strangely enough, I've used this for a really long time, which has given me a nice sample of how people have responded to this. So the way I do this particular activity is I'll ask people what they see. What are the facts? So people will look at it, and inevitably, with a few rare exceptions, inevitably someone will say, oh, I see someone dying. It's the guy on the ground. Or I see that woman is crying. And I will say, well, how do you know that she's crying? Well, she has her face in her hands. And I said, so there's the fact. Her face is in her hands because we actually don't know that she's crying, because she could be laughing because she's about to inherit from whoever has just died. And so people start, they're all excited about this activity because I do it really fast. It's about 2 minutes. Then I tell them they have to go to the facts, and we become automatons. I'm not going to do the robot dance because I can't do it as well as Jim. But it becomes this, there's a tree, there's a boat, there's some water. And then I say, okay, now what do you think's happening? And then we get all the energy back again because we love stories. So just like we fill in our perceptual fields with our literal physiological blind spot, we also fill in story. We love to tell stories. We learn from stories. It's our communicating, but stories are not necessarily well, they aren't facts. They're based on facts. A little aside, what was so interesting, because I'll say to people, well, how come you're all having different interpretations and you see this differently? And, you know, it's your experiences, your childhood. We all know our entire families are in the rooms with us, et cetera, et cetera. What was interesting is that I was using this image when Bountiful, the polygamist community, was in the news. And for the period of time they were in the news, the interpretation of this were those were 4 wives. Before that, never had that interpretation. Since, haven't had it, but it was actually quite fascinating. So, interpretations are not facts, and all you good critical thinkers are sitting there thinking, well, that is obvious. My challenge to you is spend some time listening to conversations or just watch Donald Trump, and you will find that that is not how most people believe. And when I've done this, when I used to do more training, there would be people who would have epiphanies about their relationships at home with their significant others, thinking, gosh, the reason we are bickering is it is all interpretation and not facts. And for us to be able to solve the complex problems in healthcare, use collaboration and innovation tools, we can't be getting this wrong. So we have to be paying attention to what's happening with those pieces. So in addition to some perceptual problems that get us the facts slightly incorrectly in the first place, and then we make interpretations, we also have a whole bunch of cognitive biases and other psychological phenomenon. And I've put a number of them in here, the ones I think that are relevant to innovation. If you like this stuff, Daniel Kahneman won a Nobel Prize for it, and he wrote a great book called Thinking Fast and Slow. This is me, my exuberance. It's so interesting. Some people might think it's like watching paint dry, but it is actually a great book. And he talks a lot about these. There's a ton of research on this. It's really important that we know how to manage these different cognitive biases. I'm going to just land on a couple in the interest of time. I like this one. I like the stars that say no, but we see yes. Confirmation bias. We're always seeking out information that supports our existing viewpoints. Gosh, do we ever love to be right? It's so hard to be innovative if we want to be right. The Challenger disaster, Chernobyl, confirmation bias was definitely an aspect of that, or alleged to be. Status quo, we can understand how that works. I'm not going to stop on that one. The not invented here bias, Jim talked about the hospital down the street that they wanted bad things to happen to. It's because goodness knows we can't go and take something from somewhere else. Although he also did say, if I remember correctly, that we're really good at borrowing here in BC, so we may have gotten beyond this a little bit. I had a funny thing happen though around this not invented here bias. We were doing some strategy, had a bunch of clinicians in the room, and I was using a model, a framework to think about it from someone from Harvard Porter. And people were just not having a lot of pushback on the way it worked and all of these things, and I was trying to be convincing and that this was a good way to look at it. It's just a framework, we'll have a conversation. And then I remembered this, so I went to the New England Journal of Medicine and I found a doctor who had written about strategic planning with the same model, gave them all the article, we had no problem, we kept moving forward. Apparently the person writing in the New England Journal of Medicine had a lot more credibility than I did advocating for it. But where else are there cool solutions? My other aside is I took my husband and I took our granddaughter and her brother and her parents to Disney World in November. Disney is doing something right now. I always say to people, we should look at Disney for how we move people through the healthcare system. And people are like, Disney? But Disney may have something to offer us. How do we go, not just, I know that the sub-silo, it's daunting to even think of going up a floor in the hospital, let alone looking at Disney. But what if? What if we actually looked at Disney? They move people around Disney, and the things they're trying to accomplish are not that different from healthcare. Had to have a slideshow with George Clooney. So George Clooney, this is when, and this also, I'm stopping on this because it kind of links with Not Invented Here. How do we privilege certain people and their knowledge? How is it that George Clooney, handsome George Clooney, the actor, all of a sudden has such a huge political voice? How is it that a billionaire, bankrupt person all of a sudden becomes the voice of global politics? I don't know, but it's the halo effect. So it's just being mindful that when I used to do a lot of team building, the solution in the team building experiential stuff we would be doing 20 years ago often came from someone who said the answer, but it was a person who wasn't perceived to have voice in the system and they were overlooked. We don't want to overlook innovation and overlook ideas because we really can't afford to. So we've talked about now perceptual things. We've talked about cognitive biases, interpretation, and then we also have these behavioral phenomenon. I can't go through all of these. These are fun. Well, they're horrifying because they were done when we could do research that was not exactly following any ethics committees, but they're interesting. Let's not say fun. They're interesting, and these are really great things. Again, pull up stuff and ask your staff, ask your teams, ask the people you're working with, hey, do we have groupthink here? What does the Stanford prison experience have to do with our work? There's a great movie out around the Stanford prison experience. What it says is that the Coles notes on it, without giving anything away, or that situation matters and we can all be someone that would be unrecognizable to ourselves given the right circumstances. I think you've been presented on the Mid-Staffordshire Hospital case from England on several occasions. A lot of these kinds of phenomenon also go into explaining some of the things that are happening under crisis. I work with moral distress. This all feeds into these different aspects. And the last one is our self-belief. As a rule, we disbelieve all the facts and theories for which we have no use because they don't agree with us. The most important one in this is the fundamental attribution error, which has 3 areas. It is the most oft-studied thing in psychology. And yet we often don't just wander around talking about the fundamental attribution error. But of the 3 things, this one piece is that we overemphasize individual personality over situations. This morning in the plenary, we heard a call to say, think about the system, think about the system, think about the situation. It is rarely, and I think I've worked with tens of thousands of people at this point now, there are very few people who are showing up trying to do it badly in the wrong way to be harmful. Doesn't mean we all do it well, but we so quickly think that it absolutely must be a person, and that is just devastating to the system, and it turns off our curiosity. So fundamental attribution error. And the last one is, because you've all been listening to this, and there is according to research, there must be a large number of you who say, that's nice, Cheryl, all of those things happen to other people, but they don't happen to me, but we've studied you. And so, they do happen to you. We just don't believe that we are susceptible to making any of the errors that all of these other people are making. And again, that also can get in the way. But the thing that gets in the way the most, and why I studied it when I did my dissertation, is blame. So, I'm sure most of you have some familiarity with James' reason and work on safety because of the work that you're in. You've probably heard of to err is human when we realized that there was a lot of incidents. I think that's probably some of the founding of your field. So for me, when I looked at the system, I saw an awful lot of actually leader scapegoating, which is what I wanted to do my dissertation on. And I shifted it to look at systemic blame and the culture of blame in healthcare. That's not about patient incident reporting. This is about day-to-day operations in hospitals and in hospital administrations around blame. I interviewed 17 senior leaders across all of the health authorities. They had 486 years of experience. All but 2 were clinically oriented, and the results were quite devastating. What was so interesting to me about it is that they talked about blame in 2000. We then went on just cultures. We went and looked at no blame incident reporting. But other than myself and Guarini et al. From Italy, no one had actually asked if blame was prevalent. So when people say, oh, what'd you find out? And I say, oh, blame was prevalent, people say, well, you know, yes, Cheryl, we know that. But nobody had asked us. So what that tells me, my inference from that, is that we are normalizing blame. So what I found, and why this is so relevant to innovation and creating a culture where ideas grow, is that blame functions as a vicious cycle. It's a positive reinforcing feedback loop where we have blame, most of which is unwarranted. This isn't someone clearly does something and then we blame them and there's a consequence. This is someone, there's a problem and we just throw that blame out. People described it as a hot potato. So blame is unwarranted. Blame feels bad. We develop a fear of blame, and so we avoid blame by deflecting, defending, and denying. The challenge with that is that blame begets blame. So you see some of these statements were absolutely devastating. Jumping to conclusions is typical. It's quite devastating ultimately. Blame is about shaming somebody. These are quotes from the research participants. It's about making someone else feel bad so that you can feel better. I think it's a bit of fear. We blame people. Makes everybody nervous. People are afraid to step out and do anything. I'm thinking this doesn't sound like a culture of innovation to me. We deny, we defend, and then we deflect. I don't want to get into trouble for something, so it's going to become somebody else's fault. I'm going to pay it forward, or I'm going to think of every excuse why it's not my fault. So the other thing that came out of this study, I'm picking 2 of the main pieces here, is that it results when you have blame begetting blame, and I'm sure some epidemiological person could do some interesting modeling about what that might look like, is you get a culture of blame. And this was, took myself aback, took my committee aback, and took the people who've seen some of this research aback. The 2 main markers in a culture of blame are mistrust and underground communication is the first one. There was very similar to what was the word? I asked Christina, what was the word that was in Lakshman's? Jaded. Lakshman talked about people being jaded this morning, and he was so surprised at that word. Well, I was so surprised to hear people talk about underground communication. It was this random thing that appeared that there's this whole other area of communication in healthcare that's happening because of the mistrust and the culture of blame. And the second one, and the relevant one today, is risk aversion and its impact on innovation. So that last quote says, so no matter what role we're in, we all make an impact on the patient with our decisions and our actions. So ultimately, if we work in a blaming organization that's going to have a negative impact on patient care, people aren't going to be innovative. They're not going to take risks. They're not going to be out there trying to do things differently that are going to make it better for the patients or families, or maybe even more cost efficient. So the summary is that we have perceptual distortions, and we interpret all the time. We have this myriad of biases, behaviors, self-beliefs, and they're not always conscious choices. Blame, interpretation, biases, social, psychological, behavioral, cognitive phenomenon are exacerbated by stress and pressure in the system. And so we must address these in order to have a culture of innovation. I think that I think that my premise is that people are naturally creative. People naturally have ideas. We spend a lot of time thinking about change management tools. I'm absolutely guilty of that. Change management frameworks. What can we add? What can we add? What can we add? My suggestion to you, my invitation to you, is this was identified in 2000. That's 16 years ago, that blame was an issue in our organizations. And so we did something about it in a tiny little way around patient incident reporting. And that isn't to minimize it. It's to say that how do we change that culture? Because if we did that one thing, it is my belief that all of the innovations and the ideas, we wouldn't need to spend so much time thinking about what do we need to do to set them free, because they just would be, because people would feel safe and they would be feeling connected, and it would be just a very different environment. Because you cannot build a culture of innovation on a broken foundation. So, what can we do as individuals? This is all about actions. This has to be the most action-oriented group I've ever heard of, with all these 7,000 change initiatives and all the wonderful work you're doing. Stop the cycle of blame before it starts. Infuse into our culture, if I'm going to blame, especially if it's unwarranted, recognizing that my only Dr. Philism is you are either contributing or contaminating, and every time you blame, it's a contamination. Use some critical thinking and facilitation methods. The great news is you guys are PDSA experts. That's your best way to mitigate against these biases. And I know this is a bit shocking, but have conversations, be consultative, listen. I did a session in October. We had 70 people from all over the province, and I had one person say to me, a senior leader say, I don't remember the last time I was actually given space to sit down, think, and have a conversation with others. Be solution focused. Our prefrontal cortex is so happy when we're being solution focused, as obviously compared to blaming. And the easiest thing is to check it out. We know that we are always interpreting. I said usually, but I want to say always because it's so frequent. You're usually interpreting, and other people are usually interpreting you, and those interpretations, they grow and they grow and they grow. At the end of this, we've talked about it. I sat in that workshop this morning. There was music. People were laughing. They were having fun. We were in this wonderful environment. We were truly experiencing what a culture of innovation felt like sitting in that workshop. It's supposed to be fun. It's the best thing about being human. We love, we cry, we feel, and we're creative. I think we heard about an existential crisis this morning. We were given tears to deal with existential crisis because we feel deeply, but we were also given laughter. So I've got a few little things to remind us of how absurd sometimes the world we work in is. So it's always cozy in here. We're insulated by layers of bureaucracy. It's the invention of the wheel. Nice, but we'll need an environmental impact study, a warranty, recall bulletins, recycling facilities, 24-hour customer support, a PDSA cycle, and I'm sure there's an accountability measurement in there somewhere for this cartoon. Yes to innovation, but no to change. Not so sure how that works. I'm right here in the room and no one even acknowledges me. I actually, when I'm doing workshops, I have elephants in the little boxes of supplies, and people shockingly use them, and then it just becomes part of our language. We talk about elephants, oh, it's a thing we can't talk about. This is really an innovative approach, but I'm afraid we can't consider it because it's never been done before. Oh dear, status quo bias. Anybody see that? And the final one is good news, everyone. Our innovation problems are solved. I got this whole jar of magic beams for only $250,000. So, go forth and innovate. Thank you. I have loved my time here. You are a wonderful group of people. These kids look like they are having the time of their lives, and oh, that we could have those faces. So thank you and have a wonderful weekend.